Well, it's been, I think, definitely over a month. Um, I have watched my previous videos and I realized that I look away from the camera. I look up. I don't know. I make funny facial expressions and I don't know. It's a weird thing to get used to. But I'm going to try and do better about looking into the camera. Um, excuse me, I'm sorry. I have been sick. I had surgery at the beginning of June. I've had an injury to my right foot. I ruptured a tendon in my right foot, and when I ruptured the tendon, it pulled bone away. And so I had to have that repaired, and that has been a big thing. I actually started having some pain in my foot. I think it was probably sometime in February. And I went to the podiatrist, and they said that I had tendinitis. So they put me in a boot, and I was walking around in the boot for several weeks, and it helped. So I was getting ready for bed one night and just walking back to my bedroom, and all of a sudden I couldn't put weight on my foot, and it was pretty bad. And the next day my foot was bruised and swollen, and that happened to be the day that I needed to take my puppy to be neutered. And so, you know, I put a shoe on and I went about my business. And I think that was probably a big mistake, because it just got even more painful. And I ended up going to the emergency room, and they did an x-ray, and they told me that they felt like I had ruptured a tendon, and that I needed to go back to the podiatrist. So I went back to the podiatrist, and this is March by the time this is happening. And I had surgery on June 1st. That's several months. And I was not at all happy that it was taking so long to get a surgery date, because I had bought a membership to a pool that I was really looking forward to. I live in an apartment building for people who are over the age of 55. And it's a very nice setting where there are plenty of places for people to gather, you know, inside and outside. And a lot of people just stay in their apartments, and I just can't do that. I'm not good at being alone. And I know I have my pup, but you know, it's nice to have a conversation with a person who can, you know, have the conversation with you. And so, anyway, I was looking forward to getting out of the building and being around people. And with this injury, I wasn't going to be able to do that. And when, I saw this podiatrist, this particular specialist for my particular injury, it was the end of March. He sounded like they were going to get me in for surgery right away. And so, when I'm looking at the 6 weeks of recovery, plus 4 weeks after that with a boot on, but putting weight on it, I'm thinking, this isn't going to be a big deal. It's not going to get in the way of what I wanted to do this summer, but it took forever to get a surgery date. Then I had surgery, and the very next day I started running a fever. I had infection in my wounds, and when I saw this specialist for my particular injury, he said, yeah, we'll do a little incision here and a little incision here. Okay. After surgery, my post-op appointment, and he took the dressings off. Oh, it wasn't a little incision here and a little incision here. No. It was at least 15 incisions. When I saw my foot for the first time after surgery, it was like, wow. I was shocked. I was really in shock. But he sent in an antibiotic. I took the antibiotic, and I think it was, I don't know, maybe a week later, I started running a fever again. And when I was going into his office and he would change the dressings, me and my husband were both looking at the wounds thinking, I don't know, they don't look very good. But he was saying that they were all okay. And I wonder, because I have type 2 diabetes, maybe he was thinking she heals slower because of the diabetes, which is a possibility. But no. No. The antibiotics that he had given me weren't working. And so more than a month after surgery, I was doing the dressing changes here at home. And I had pus come out of one of the wounds, and I was like, no. And it was hurting, and I was feeling really sick. And I called a friend in the building to come up and look and give me her opinion. And another lady came up and looked and gave her opinion too. And so then I ended up calling 911. I tried to call my husband, but he wasn't answering, and I'm sure he was really busy. So anyway, I called 911, and when the EMS, shone a light on my foot, he's like, it's definitely infected. And normally they will say, do you want us to take you to the emergency room? But they didn't ask me. They got me on their stretcher, and I went. They did ask me what hospital I wanted to go to, which is kind of unusual, but I'm glad that they did, because I did not want to go to our local hospital. I would have preferred to go to the hospital that my surgeon practices at, and that's where I went. And I was admitted for, I think it was 3 or 4 days, and they tested the wound, and they determined what the bacteria was. Of course, they put me on IV antibiotics and all was good. They cleaned the wound and dressed it. And they decided to discharge me, though, before the results had come back for the bacteria, to find out what antibiotic I needed to be on. But once I got on the right antibiotic, everything has been healing very nicely. Like, I wish that he had tested the wound weeks ago, because they could be very well healed by now. But, it is what it is. Let's see. Oh, and then I got an upper respiratory thing. Ugh. Which, lingers when you have asthma. The cough lasts forever. So I'm dealing with that still. But I started a Bible study yesterday that so far I feel pretty good about. I feel like I'm looking at my personal relationship with Christ in a different way. And maybe I should have graduated to this place a long time ago, because I've been saved for more than 30 years. But I guess that, there are things in life everyone experiences at different levels and at different stages. And I have gotten to some stages that have caused me to grow in ways that I've needed to grow. I should have grown a long time ago, but I am not a patient person. I do lose my patience pretty easy. And like this whole thing with this injury, and it has been killing me that I haven't been able to go to the pool. I was really looking forward to that. But, if there's one huge lesson that God has been teaching me over the past year and a half, it's patience. And why patience is important. It's not just a matter of being mature, but it's also a matter of personal growth and being ready to graduate to the next thing. And, while my kids were growing up, I really wish that I had been more patient. They really needed that. All kids need that. And even in my marriage, patience is important in every aspect of your life. And so this whole thing with my foot and not being able to move forward with what I wanted to do this summer, it really has tested my patience. But I started a Bible study because I really want to understand how everything in the Bible pertains to me and relates to my life. And I want to understand the Bible and what everything that it says means, why it was so important for that particular piece of information to be in the Bible. So, but you know what? In all the years that I have been saved, I have tried to do personal Bible studies. I have bought workbooks that give you reading, and then you have a worksheet, and nothing has really quite worked. And when I went to Alaska last summer, I had bought this Bible study that I thought it was really gonna work, and it didn't either. So I am starting in the book of Mark, and I'm taking it slow, one chapter at a time. I'm not necessarily trying to do one chapter a day, because I want to give myself time to think and reflect on what I've read and the lessons that I can learn from it, and then how I can apply those lessons to my life. And I might not be the most interesting person on YouTube. I don't know that this is going to turn into anything. I don't know. I hope it does. I mean, I hope I can figure it out and make it interesting, and grab people's attention, that I can get monetized. I don't really care anything about being a big famous YouTuber, but I am on a limited income, and some extra income is always welcome. So maybe I'll have more for next time, but for now, I'll talk to you later.